Let's take a look at congestive heart failure, or CHF. So, back to the heart. Remember, it's got two chambers. Two up top are the atria, two on the bottom are called the ventricles. The right side of the heart receives blood from the superior vena cava and the inferior vena cava. They drain blood, used blood that has been used by the tissues and is low in oxygen and high in carbon dioxide content. Both the superior and inferior vena cava dump into the right atrium. The right atrium pumps to the right ventricle, and the right ventricle pumps out through the pulmonary trunk and out through the left pulmonary artery and the right pulmonary artery, which become our pulmonary arterioles, which become pulmonary capillaries, which then drop off the CO2, pick up oxygen. We come back to the heart through the pulmonary capillaries, which become pulmonary veins, which become pulmonary venules, then become pulmonary veins, and then they dump into the left atrium. The left atrium pumps down to the left ventricle, and the left ventricle pumps out through the aorta to the head, the arms, the trunk, and the rest of the body. Now, if the right side of the heart is failing due to weakness, due to muscle weakness, muscle damage, such as that experienced in a right-sided heart attack, the heart will not be able to pump blood effectively out of the right side, so blood backs up. Well, because of gravity, we see it most prominently as pedal edema, peripheral edema, swelling of the ankles. When the left side of the heart is not functioning, as in left-sided heart failure, the blood that enters the left side of the heart comes from the lungs. So then the blood backs up through the pulmonary system out into the lungs. The pressure is so high within the pulmonary capillaries that some of the fluid leaks out of the capillaries into the surrounding interstitial tissue. So this is what it looks like. We're coming from the right ventricle, okay? And we're coming from the pulmonary trunk, pulmonary arteries, pulmonary arterioles. Here's a pulmonary capillary. We're attempting to drop off this carbon dioxide, but the problem is that the pressure is so high that we have a lot of fluid leaking out from the pulmonary capillaries into the surrounding tissue, the surrounding space. We call that pulmonary edema. So now we've got all this fluid that's accumulating around the alveoli and in the space in between the alveoli and the pulmonary capillary. Now, normally the carbon dioxide would not have a problem diffusing through these four membranes. Remember, it has to diffuse in, then out of this simple squamous cell, then in and out of this simple squamous cell to end up going into the alveolar space. However, because there's so much fluid that accumulates in the interstitial space here, this diffusion is really hampered. So is the diffusion of oxygen from the area of high concentration in the alveolar space across the interstitial space and into the pulmonary capillary. So that's prevented as well. So now the patient is not only hypercarbic, they can't get rid of enough carbon dioxide, but they're also hypoxic. They can't get enough oxygen. So the first treatment we use for this is left-sided congestive heart failure. The first treatment we do is put the patient on oxygen. Okay, we're going to put them on an oxygen mask, and then we need to get rid of that extra fluid. Well, how do we get rid of the extra fluid? Some of the things we can do are medications. So you can give medications that pretty much tell the kidneys not to hang on to water, because the default is to reabsorb water, hang on to the water, because otherwise we'd get profoundly dehydrated. So one of the things that happens is that the kidneys are instructed to hang on to the water, to not hang on to the water, and to in fact get rid of it and actually produce more urine. So we're taking water from the body, putting it in the urine and getting rid of it. And in doing so should dry up the pulmonary